Thank you for joining us. We offer these videos to give you a personal look at our center so you can experience the Falls Church Healthcare Center difference. We make a difference every day.
Your abortion care appointment can now be completed in one office visit thanks to the July 2020 Reproductive Health Protection Act. We are excited about these improvements that the RHPA has enabled us to provide you, and we hope you are too. For more information, please visit fallschurchhealthcare.com.
I'm Margaretha, one of the registered nurses at Falls Church Healthcare Center. As you approach your decisions about selecting your healthcare provider, join me for a few minutes to tour our center. First, I want to say we at Falls Church Healthcare think it's vital that you're able to consider all options available regardless of your financial status or insurance coverage. We think it's important that you go to a center that can give you those options and can provide you the type of care you prefer. We provide both medication, or the abortion pill, and aspiration abortion care. Come on in. Welcome to our newly renovated center. This is our registration counter and lobby. When you first arrive, we ask that you sign in at the front desk and then take a seat. Our receptionist will call you up to get your paperwork. Once you've completed all of your paperwork, turn it back into the receptionist and make any payment. We'd like you to meet Mike, one of our center's escorts. Mike, tell us a little about the Washington Area Clinic Defense Task Force.
Sure. When you first come to the clinic, you're going to see me and my fellow volunteers at the Washington Area Clinic Defense Task Force, or WACTF for short. We work very closely with many clinics in the DC metro area, including the Falls Church Healthcare Center. We are here to assist you with easy access and parking and escort you to your appointment without hassle if there are protesters on the sidewalk in front of the building. You'll know who we are by these fashionable orange identifiers. Safety is of the highest priority for Falls Church Healthcare Center, and we are an important part of that.
Thanks, Mike. Now, let's go to the next stop of your appointment. This is the laboratory where your vitals, pulse, blood pressure, height, and weight are recorded. We do other necessary tests such as checking your iron levels and your RH factor. Once that's done, you return to the lobby. Following your lab visit, we're going to bring you back for an ultrasound. The ultrasound lets us know the status of your pregnancy. The nurse will also review your medical history and discuss the abortion methods we provide. This is our health education wing. This is our quiet reflection room, available for private discussions with your support person or your doula. We'll introduce you to one of our doulas later on. Now you'll meet privately with one of our health educators. At this point, if you'd like to have your support person come in with you, you're welcome to do so. Just let us know. During this part of your appointment, each of our patients, even those who are very certain about their abortion decision, will have an opportunity to discuss the procedure and, if you wish, your feelings and concerns. Some women come into our facility with a lot of anxiety. We provide abortion doula services. Meet Tahira from the DC Doulas for Choice.
Hi, my name is Tahira Henderson and I volunteer with DC Doulas for Choice. I've been volunteering with the doulas for a little over 3 years, but our doulas have been volunteering with the center for over 7 years now. When patients come in, I see a lot of nervousness, and then they come and sit with us in the doula office and we explain to them how the doula program works and that someone will be there to support them and hold their hand throughout the process. This decision comes out of responsibility and love. Now you're all set and you'll be called back shortly when we're ready to start.
You'll be called back to the doctor's office for a medication abortion or to the procedure rooms for an aspiration abortion. When you first arrive in the back, one of our female medical assistants will greet you. If you're having sedation, you will have the anesthesiologist with you as well as the physician. The aspiration procedure itself takes only a few minutes. This is our patient lounge. Following your procedure, you will have ample recovery time in the patient lounge with refreshments and food. You will be discharged with written and oral instructions for aftercare and what to do should any questions arise. You can get back to most of your normal routine and activities right away. Our staff is here to answer any questions you have about your at-home care. One of our mottos at Falls Church Healthcare is, "When you come here, bring only love." We understand that choosing to end a pregnancy is not always an easy decision, so it's an honor to be part of that process. I trust that patients here feel safe, that they experience the highest level of health care, and that they also have the opportunity to learn new information. Women of all ages should feel confident knowing that at Falls Church Healthcare Center, your comfort and health is our priority. We believe that the world is a better place when women have the ability to make their own decisions regarding their bodies, pregnancy, and reproductive health. We are proactive in respecting and maintaining these rights as part of our mission. On our website, you can learn more about our history and mission, medication and aspiration abortions, and review the comprehensive gynecological services we offer, especially family planning options. Thank you for joining me, and I hope this video has been helpful.
FCHC, as when we opened in 2002, is returning to the way we safely welcomed patients for abortion care, completed in one visit. You will no longer be subject to the 24-hour waiting period in Virginia that was begun by the legislature in 2011. For over a decade, FCHC safely and responsibly offered abortion care in a single visit, and now we can do so again.